pterygomaxillary fissure. So, laterally with temporal fossa through gap under the zygomatic arch, anteriorly with orbital cavity through inferior orbital fissure, medially through pterygomaxillary fissure with pterygopalatine fossa, and superiorly through foramen ovale. It is in communication with which cranial fossa? Here is the pencil, you can see. Which cranial fossa? Middle cranial fossa. So, in middle cranial fossa, foramen ovale and spinosum connect the infratemporal fossa. So, these are the communications. Somebody may ask what are the communications, you can tell that way. It communicates with orbital cavity, it communicates with middle cranial fossa, it communicates with pterygopalatine fossa, it communicates with the temporal fossa, and so on. Through what you just saw it. So check this in the skulls which you have. Okay, clear?
Yes.
Okay. Then you have now the coming to the contents of the fossa. Okay. Now here in this model we have removed the mandible. Okay. Right from there the mandible is removed. Okay. So we have removed the mandible, as you can see. We have also removed the maxilla. Both the mandible is removed, maxilla is also removed. Half of the things are removed, and you can now clearly see the pterygoid plates there, and you can also see few muscles there. Can you identify this muscle?
Lateral pterygoid style.
This is your submandibular salivary gland. This is mandible, anterior belly of digastric. This is the styloid process. From styloid process, there is a muscle going to the tongue. Can you see? This is your tongue. Okay. So this is styloglossus muscle. Glossus means tongue. This is styloglossus muscle. Okay. There is a muscle which is having this posterior belly, then anterior belly. Okay. This could be your digastric, or if it is coming from mastoid, it is digastric. If it is coming from styloid, it should be stylohyoid. Okay. Okay. This is your posterior belly of digastric. This is the digastric from the mastoid process, and this is stylohyoid. Okay. So the muscles on the styloid process plus digastric and sternocleidomastoid. So all these will form the posterior wall of the infratemporal fossa. Okay. And you can see a few of the vessels there as well, very deeply located. If I turn the model, now you can see the very deeply located maxillary artery. Okay. But the idea of showing this model is to note the posterior wall, which is muscles on the styloid process, and the digastric muscle. Okay. But you have the other model, which is very good, showing almost all the contents of the infratemporal fossa. Is it focused now?
Yes.
Yes. Here again you can note that you have removed the mandible from here. You cut the mandible and remove the upper part of the mandible completely, so that you also remove the skull, base of the skull, so that you can completely expose the infratemporal fossa and see its structures. Now here you can see that you are having this artery here. This is your external carotid artery, and Then you have got its branches known as superficial temporal artery, which will go up, okay, and you are having this maxillary artery, which is trying to enter to go to the lateral pterygoid plate. After crossing the lateral pterygoid, it is trying to go in the lateral pterygoid, behind the lateral pterygoid plate in the pterygomaxillary fissure, okay. And here you can very easily note the nerves which are there. What you can see, you can note this one, posterior superior alveolar nerve. Can you see this? Okay, posterior superior alveolar nerve here, and you can note here the nerve going to the tongue. Okay. This one, this nerve is going to the tongue. This is your lingual nerve, and this lingual nerve is receiving a very slender nerve. Can you see this white nerve here?
Yes,
This is your chorda tympani nerve. It carries test fibers. This is the chorda tympani nerve, okay, and it is joining the lingual nerve, okay. And then behind this, you are having this inferior alveolar nerve, which will enter in the teeth to supply the teeth there, all the way like this. So this is your inferior alveolar nerve, and you can see the two loops of the auriculotemporal nerve. So this is your auriculotemporal nerve. Is it visible?
yes,
Okay, so this is auriculotemporal, this is inferior alveolar, okay, and it is coming to supply the teeth, okay, right, and here you can see the chorda tympani nerve, this nerve, white nerve, slender, is joining the lingual nerve there. Okay, apart from that, you can see the branches of the maxillary artery. Here you can see the maxillary artery very clearly. The ascending branches, okay, are located here. It's middle meningeal artery going to the foramen spinosum. This is inferior alveolar artery. This is posterior superior alveolar artery. And if you turn this way, you can see the medial pterygoid muscle here. Okay, you can also see the lateral pterygoid muscle there. So almost many structures, all the structures of the infratemporal fossa are shown here. Okay, you can also see the cranial cavity, trigeminal nerve is 3 branches. Ophthalmic goes to the orbit, maxillary goes to the foramen rotundum, mandibular goes to the foramen ovale and comes out here and divides it into branches. Before dividing, it gives branches to the pterygoid muscles, and then it gives inferior alveolar. This is your buccal branch. This will go to, this is the buccal branch, okay. This is lingual branch, and this is your mandibular branch, okay. So all the 3 branches are very clear. So we have 2 such models, one is there, one is here. So you are supposed to see that, okay. Apart from these models, we have some bigger models where you can see the muscles of the mastication very clearly, like in this model or in that model. Here you can see the masticatory muscles, temporalis is clear, masseter is clear,